Hey, future medics, it's me, Tina, your medic mentor, and today we're talking about a beta blocker you're not really going to see on the box, but it is still important for you to know. The name is propranolol, and the brand name is Inderol. Now, this one, while you may not see it in the ambulance, it is going to come up during pharmacology and probably your cardiology lectures. So let's talk about it. This one is a non-selective beta blocker. And it blocks beta 1, your heart, because you have one heart, and beta 2 receptors, lungs. They're in your lungs because you have two lungs. So beta 1 heart, because you have one heart, beta 2 is in the lungs because you have two lungs. Okay? So by blocking that beta 1 receptor, we're going to see a decrease in heart rate and cardiac output and contractility, right? But by blocking beta 2 receptors in the lungs, it causes bronchoconstriction, which is really dangerous for our COPD patients and our really bad asthma patients. It's part of why you don't see it so much anymore. So when do we use this? Well, it's going to be an at-home medication that you're going to find in your patient's house, and it's often used to manage hypertension, angina, AFib, SVT, and also, oddly enough, anxiety, and sometimes even migraines. The dose is 1 to 3 milligrams IV or IO over a slow IV push of 2 to 3 minutes. So take your time with this one. Onset, quick, 2 to 5 minutes, but it lasts 4 to 6 hours, quite some time. And then, of course, it's more common for us to see the oral medication that our patients are taking at home. So side effects with this one are going to be what we're used to seeing with beta blockers: bradycardia, hypotension, dizziness, and fatigue. But because of that beta 2 blocker, we can see some bronchospasm and constriction. Now, looking at the contraindications, about the same as the others that we've seen. We're going to be contraindicated in anyone who's already hypotensive, who's already bradycardic, because of that beta 2 blocker, anyone with COPD, but also those high heart blocks like second degree, third degree, and higher, and anyone in cardiogenic shock. Here's your takeaway. Propranolol is an old school, non-selective beta blocker. We don't see it that much anymore, but don't be surprised if you see it in the home medications of your very elderly patients. It is good at what it does, but make sure that you keep an eye on their airway since this can cause bronchoconstriction. But that's it. That's another medication knocked out. You're doing such a great job. I'll see you for the next one.